the reasons that we are doing this is because so people know what's going on. And the last gentleman that talked about not knowing about Part D, and that passed several years ago, and I know that we had several events on that so that people would know about Part D, and we in our office and had people come in from Medicare to help people sign up, and we had forums where not only did we have what you needed to know about it, but then we had providers who were going to be involved with this, the actual people, and so that they got to talk to everybody. But it's really hard, I think, for all of the things that are going on for everybody to know. So this is one of the reasons why we hold a forum like this, so that you'll be able to know who to go to. And I think that's the hard part. But remember, we've got constituent services in the office, and so anytime you've got a problem, give us a call like that. People that work on immigration, IRS, Social Security, Medicare, and Medicaid, education, whatever. So we're here really to help you all when you need some answers. And then we can direct you to those agencies and make sure that you get the answers for this, because it is complicated. So with that, we next we're going to have a talk on CMS, so that you get to know what's going on in Medicare. Let me tell you, this is on currently, what you need to know, what you need to do. So David Lisek is representing CMS from the state of Illinois next, and get ready with your questions, and if David will come up now, we're ready.
I don't know, whatever works. I'm kind of a loudmouth, so if I'm too loud, just tell me. I know some people have hearing aids. We'll talk about that in a second. CMS, ma'am, is Centers for Medicare and Medicaid. Centers for Medicare and Medicaid Services. We'll go into that in our presentation. I'm here today representing CMS. I'm basically pinch hitting today because they had an emergency. I am from the state of Illinois, the Senior Health Insurance Program, SHIP. I know I talked to a lot of you there. What we do is we work directly with Medicare and CMS to help educate Illinois consumers on how to navigate the Medicare system, because it's very, very complicated. So we have an 800 line, and we have counselors throughout the state to help you navigate it. So I'm going to present CMS's PowerPoint here today. It's basically just on the basics of Medicare. Some of you I've talked to know it already intimately, because you've been on there a while. I've talked to a few of you who are just getting ready to get started in a few months. So we're going to go ahead and go with this, and at the end, I'll answer what questions that you have. If I can't answer your questions, I'll get your information, and we'll get you an answer. Okay? So with that, we'll go ahead and get started. All right, basically, what is Medicare? Health insurance for people that are 65 and older. Also, for people that are under 65 that have disabilities, certain disabilities, and we'll talk about that in a second. That's determined by the Social Security Administration. And anybody of any age that has end-stage renal disease is eligible for Medicare. And like the young lady before me, this presentation that they sent me has a couple of slides in here with some statistics and stuff. I'm not going to bore you, so if I just go right through those, don't beat me up. All right, Medicare. What is it? Medicare is administered by the federal government. Like I said, the Centers for Medicare and Medicaid Services, they are the ones that administer the program. But the enrollment is done by the Social Security Administration for most people. For some people who work for the railroad, it's through the Railroad Retirement Board. Majority of people get enrolled through Social Security, some through the Railroad Retirement Board. This is just some of their stats. We've got 48 million people on Medicare. 25% are Medicare Advantage plans. I'll talk about those in a few minutes. And currently in 2011, the United States has spent $549 billion on Medicare. Okay, this is just a bunch of statistics of how many people. I'm not going to bore you with that. Medicare, the basic parts of Medicare. There's basically what they call 4 parts of Medicare. Part A is your hospital insurance. And we'll talk about that. That's free for most people who've worked 10 years. I had a spouse that worked 10 years. Part B is your medical insurance, covers doctors and those kinds of services. Okay, there is a charge for Part B. We'll discuss that. Part C is an area where a lot of people have confusion. Part C is what they call Medicare Advantage plans. All that is it's your original Medicare, is what they call A and B. It's wrapped up into a private plan contracted by CMS, basically usually has like HMOs, PPOs, that kinds of things. So it's an alternative for a lot of people. A lot of people like it because a lot of times you can get it cheaper, but you also got to use networks. So it's just another alternative choice for you. And Part D, which started in 2006, is your prescription drug plan. So those are the 4 basic parts of Medicare. Medicare decisions. I've talked to a few people today, like, well, what am I going to do? Do I have to take this? It can be very complicated. Just like the representative said, there's resources out there to try to help you answer these questions because there's a lot of different situations different people are in. I've talked to people, some people, they go to the VA, other people have TRICARE, others have retirees. There's all kinds of different situations. So should I take original Medicare, just A and B? Should I do an Advantage plan? Should I keep and sign up for my Part A? Should I take Part B? And when? Should I be taking Part D? Do I need a Medigap or a MedSup, medical supplement? Basically what that is, for anybody who doesn't know, it's basically Medicare does not pay for everything. It was never intended to. But if you want to buy a separate outside policy to pick up what Medicare doesn't cover, you have those options out there. And can I get help with some of these Medicare costs? So these are a few of the things we'll look at real quickly today. Okay, like I said, Part A is hospital insurance. It covers your hospital. It covers skilled nursing facilities if you need to go there after you get out of the hospital. It covers home health care. It also covers hospice care. And in addition to just hospice care for the terminally ill, it covers some services for the caregivers to help them out during that time. Part B, medical insurance, that covers your doctor's visits. It covers the outpatient services, your lab tests, your durable medical equipment, some of the things that the young lady who talked before me talked about. And new in 2012, we've got a whole lot of new preventive services. Try to keep you healthy now and keep you better so you're not as ill later. If you don't want to know about those, there's plenty of stuff back on my table over there. All right, what's Part A going to cost me? Most people get Part A free if you are a U.S. citizen or legally entered and you've worked either 40 quarters or 10 years, or your spouse has worked 10 years. Okay, you're paying, that's that FICA tax that's on your tax plan. You usually get it for free. For people who don't have those 10 years or 40 quarters, they can also get it, but they have to purchase it. Right? Or also, we're going to talk a little bit about eligibility. When should I be signing up for Medicare? There's a certain period when you become eligible that you need to sign up for these things. Some of these plans, if you don't sign up during your eligibility period, you'll pay a penalty for being late. So these decisions are really important. Okay? Part B, monthly premium. Majority of people, this is a really graphic, busy slide, but the majority of people pay $99.90. Right? If they're single and they have an income of $85,000 or below, joint $170,000 or below. If you have a higher income, you pay a higher premium. Because the majority of people we deal with pay the $99.90 a month. So everybody who has B pays that $99.90. Now, if you have Social Security, if you're getting to your Social Security, most times it's deducted right from your check. If you want it done otherwise, you can talk to Social Security about that. Okay, Part B services, how do I pay for them? In original Medicare, if you have a yearly deductible, you've got to pay the first $140 in 2012. These amounts change annually. Okay? And then you've also usually got a 20% co-insurance. Medicare will pay 80, you pay 20%. Okay? There's also programs that help with these costs and pick them up. We'll discuss those a little bit. Some of them are for people with reduced or lower income, or that's also some of those Med-Sup or Medigap policies are the things that will take up these kinds of costs if you want to purchase one of those. All right, enrolling in Medicare. Like I said, enrollment is done through Social Security or the Railroad Retirement Board. They're the ones that do the enrollment when you go into Medicare. Now, initial enrollment packages should be mailed out 3 months before you turn 65. Or if you're disabled, you have to be disabled 24 months before you become eligible for Medicare. Okay. What's going to happen is before you turn 65 or before your 24th month of eligibility, Medicare's going to send you your package. They're going to send you your Medicare card, they're going to send you the book, the Medicare and You. If you want to keep Part A and Part B both, you don't have to do anything. You just take your card, you start your benefits, and go on. But like I said, you have a choice. If you don't want that Part B, the one that's $99.90 a month, and there may be various reasons for that we'll get into, you've got to, on the back of the card, you've got to check it off and say, I don't want it, sign it, and send it back to Medicare. What they will do is they'll send you a new card that shows that you just got the Part A. The one that's usually free. Okay, how to enroll? Like I said, enrollment's automatic if you get Social Security or Railroad Retirement. For some people, it's not automatic. They have to take the initiative and enroll. For instance, this is a good example. I talked to some people that are still working. They're over age 65 and they're still working. They don't have to take Part B and pay that $99.90 a month. And they're not going to pay a penalty later for not enrolling because they're still working. But once they stop working or lose that coverage from employment, then that's when their period starts when they need to sign up. Right? You can talk to the local Social Security office. You can call their, this says call their 1-800 number, but I do want to tell you, I was at an annual conference last month. The Social Security rep suggested that you talk to your local Social Security office. Basically, advise that the 800 number line handles more basic stuff, but you can talk to the Social Security rep back there on all that. You can do also, everything these days is online as well. SSA.gov, it's got all the stuff on there. If you or friends or family navigate, you can sign up for Medicare right on there. You can basically do everything online if you want. Okay, if you're retired from the Railroad Retirement Board, they've got a phone number you can call and discuss with them. Okay, when do I have to enroll? When to enroll? You don't have to be retired to enroll. Your initial period, you've got 7 months. We call it a 3-month free rule. This is when you become eligible for Medicare. For example, if I'm turning 65, so I have 3 months before I turn 65, I have my birth month, and I have 3 months after I'm 65. That is my initial eligibility period. As long as I sign up within that period, I'm good to go. If I sign up later, I'm going to end up paying a monthly penalty because I didn't sign up when I was first eligible. Okay? And it's the same thing if you're disabled. When you get to that 24th month of disability, it's 3 months before, month of, and 3 months after. Should I keep Part B? Like I said, for Part B, you're going to pay a premium. Everybody pays a premium for Part B. Should I keep it? Should I sign up for it? Okay, it says consider. It become you automatically if you're getting Social Security. You have to pay a Part B premium. It's usually deducted from your check. And then the amount depends on your income. I can show you that slide earlier. If you've got higher income, you're going to pay a little higher premium. All right. Other things to consider, it depends, or should I talk about that? Okay, sometimes you have to have Part B if you want to do these things. If I want to buy a Medigap or Medicare supplement plan, that's the plan that picks up what Medicare doesn't, you have to have A and B. You can't get a supplement